Welcome back at 7:13. March is recognized around the world as Endometriosis Awareness Month. Endometriosis is a chronic and often painful condition that affects an estimated 1 in 10 women across the world during their reproductive years. Dr. Antonia Traina, she's an OBGYN with Touro. She's here with us this morning to discuss exactly what endometriosis is, and more importantly, the treatment options, because that's the best part. There are treatments out there for it. Dr. Traina, thank you for being here with us this morning.
Absolutely.
So let's start with what is endometriosis? I know people have heard the term before, but what is it?
Yeah, so endometriosis is actually a condition where the lining of the uterus, so the inside of the uterus, is actually growing on the outside. And so it grows specifically in the pelvis, can affect things like the ovaries, the two fallopian tubes, as well as things like the bowel and the bladder and muscles and nerves.
How does that happen? That sounds like it would be rare, but it is not that rare. So any idea how that starts happening in women?
So we think some of it is, the biggest thing we think it is mostly from what's called retrograde menstruation. So every month, we're shedding the lining of our uterus, and that's normal, but sometimes a little bit gets backflow into the pelvis. And because of that, it can go anywhere and really can get anywhere and affect any organ. So it's the biggest thing.
And it's more common than people think it is. And talk about the age group that this is affecting.
Yeah, absolutely. So about 1 in 10 women are affected by endometriosis, and it's most commonly in reproductive age females. But that can start in your teens, so as early as adolescence, 12 years old, but can also affect people into their 30s and 40s. So it really runs that whole age group.
We talked about how it can be painful, so that's one symptom and sign. But there are other signs and symptoms that we'll discuss, and because the signs and symptoms kind of range, it's such a big range of what you can present with. It sometimes goes misdiagnosed or not diagnosed. Is that correct?
Absolutely. So one of the things is that because it can affect all of the organs of the pelvis, the bowel, the bladder, people come in with painful bowel movements, pain in their bladder, and they may not absolutely have cramps with their periods. It may be outside of their normal menstrual cycles. And so because of that, they're constantly diagnosed with things that have to do with their bowels, irritable bowel syndrome, painful bladder syndrome. So things that may be associated with it, but don't actually get to the root of the diagnosis.
What do you want? I know there are people at home thinking, well, I've had one of those symptoms before, or I've had more consistent, maybe period associated or ovarian or uterine pain or discomfort that I would assume it's endometriosis, but I've kind of run into a lot of walls. I've been told nothing's wrong with me. What do you want those women out there to know this morning? I know people often feel discouraged when they can't get answers.
Yeah, absolutely. I think one of the biggest things I can say is, everyone has pain with their periods, cramps, if you will, but anything that's persistent or severe, affecting your work or your daily life, school, if you're missing work or school days because of your pain, that's a red flag. And I would say definitely talking to your gynecologist if those things are happening, because we're getting better at recognizing symptoms now, and we can kind of help in that way.
And you specialize, seriously specialize in this. Give us your information so people can reach out to you, because you're one of a few specialists of endometriosis in the city. So how can people get in contact with you?
Yeah, so I work through Touro as well as LSU, so one of the academic schools here, and I specialize in complex pelvic pain, endometriosis. Our office is on St. Charles, so you can reach us there, and we have emails through it, and you can go to LCMC and book an appointment with me as well. So.
Well, doctor, thank you so much for your time this morning and for having this really important conversation about something that's so common and that so many women just don't even know they're dealing with. We appreciate your time.
Thank you for having me.